Welcome to the Coping After Transplant workshop for adults. For many transplant survivors, the hard work was not over when you went home from the transplant clinic, and we're here to recognize that and share ways to cope with the changes to life after transplant.
So in this session, we're going to reflect on what the journey looks like when recovering from transplant and sources of distress survivors might experience. And we'll talk about how to manage chronic conditions, as many transplant survivors do experience late effects from treatment, and how long-term follow-up can help survivors.
This session is being recorded for future use, and we'll welcome discussion during this workshop, but if you have questions you're not comfortable asking here or think of later, you can email long-term follow-up. We ask that you refer to BMT Reunion in the subject line of your email to differentiate from the other clinical questions coming into long-term follow-up.
So we'd like to start with a land acknowledgement, and we acknowledge that the Fred Hutch Cancer Center sits on the traditional land of the first people of Seattle, the Duwamish people, past and present, and honor with gratitude the land itself and the Duwamish tribe.
So let's get started with the workshop. I'm Denae Davis, the nursing supervisor for long-term follow-up. I've been a blood and marrow transplant nurse for 16 years, all within the University of Washington and Fred Hutch system.
And I'm Jen Lynch, a professional practice coordinator for the Blood and Marrow Transplant Clinic, and have been a blood and marrow transplant nurse for 13 years. And we'd like to thank you so much for joining us.
We're here as representatives from your transplant team to share information and interventions, but we're here to learn from you just as much. Since you've had the lived experiences after transplant, we'll be sharing from our trusted sources of evidence-based information, but this is not meant to be individual advice. It likely needs to be adapted to work specifically for you. We welcome your stories as we go through the content, and we'll want to know what has worked for you.
So let's reflect on your journey to get where you are today. Your transplant nurses encouraged you and celebrated with you. And when you left your transplant teams and went back home, but the recovery didn't end there with that transition. Everyone here is at least 5 years out from their transplant and has walked this early path. And that early path is somewhat similar between survivors, but branches out as the years go by. And everyone's recovery journey begins and becomes their own unique path.
So do you remember early after transplant when your team nurse would ask you every day,
what did you have to eat?
Did you take a walk?
Did you miss any doses of your medications?
How much water have you had to drink? And then when you left the transplant clinic to go home, we hope you continued to think of your transplant nurse as that little angel on your shoulder, reminding you to think of these things every day when they were no longer there to remind you.
So recovery the first year was going to have its good days and bad days. There were small things that added up to make big steps over time. And sometimes the big improvements happen so slowly that it's hard to recognize the progress until you take a step back and look at the longer trajectory.
By the first year anniversary of transplant, most of the fatigue and chemo fog had cleared, but some may still remain years later. After the first year anniversary of transplant is often a time point where the recovery path branches for different survivors. Some survivors are able to stop immune suppression or didn't need maintenance medications, but many other survivors needed to continue these treatments. And every medication has side effects that can be unpleasant or affect quality of life. And it can be discouraging to feel like you're not as far along on that recovery path as you think you should be.
So the radiation and or chemotherapy used before transplant can cause damage to the body. The medications used long-term after transplant for maintenance therapy and or graft versus host disease also contribute to late effects. And this is a comprehensive visual of the various late effects a transplant survivor might experience. So survivors are not guaranteed to experience them all or even have any of these, but most transplant survivors do experience some degree a long-term change that affects health and well-being.
We estimate that more than 90% of our transplant survivors have at least one chronic health condition that is likely listed here. And there are other experts at these workshops today to speak about many of these late effects, such as memory issues, physical exercise and heart health, infections, nutrition, and mental health and chronic GVHD. So in this session, we'll take a step back from the specific late effects and talk about coping with the overall new normal. Sources of distress for transplant survivors might include physical, emotional, social, spiritual, and financial causes. And the previous slide outlined most of the possible physical changes. But it is important to recognize transplant survivors experience a variety of emotional issues, such as uncertainty about the future, fatigue, depression, low self-esteem, and post-traumatic stress disorder. Social relationships are often different after transplant, and that can make it harder to reconcile the changes in your life.
So survivors might question their previous spiritual beliefs or feel stronger in their spirituality. And financial distress is definitely an issue for many transplant survivors. And transplant-related distress is generally slower to resolve for allogeneic versus autologous transplant survivors, and also slower to resolve for patients with less social support structure at home. So, oops, sorry, apologize. So at the 5-year mark, most survivors report good physiological health in addition to minimal physical symptoms from transplant, and are often able to return to work. However, the long-term problems that most often persist at this point include fatigue and sexual dissatisfaction. And late physical effects may be developing at this point. So heart problems, hormone issues, kidney problems that were listed on the previous diagram may be developing.
We know that relapse of the original disease is generally less likely after the first 2 years after transplant, but the risk of developing another cancer increases the further out the survivor is from transplant. Some survivors may be cared for by just their oncologist or just their internal medicine provider at this point, but many transplant survivors will have at least one other specialist involved in their care by now.
So many transplant survivors have late effects from transplant and need to learn how to manage life with new chronic conditions. And the term multiple chronic conditions means dealing with 2 or more chronic physical or mental health conditions at the same time. And this is more common in the world than we might think. In the general non-transplant population, it is estimated that 1 in 3 American adults have multiple chronic conditions. It can be difficult to connect the recommendations from different healthcare providers into one plan of care. And this can be a barrier to reaching that lofty goal of optimal wellness in your life.
Navigating healthcare with chronic conditions can be difficult. We have tips for transplant survivors to help with this. This is not meant to put all the responsibility on the transplant survivor's shoulders, though. Healthcare systems need to do a better job coordinating care between different providers. I think electronic health records are helping move in this direction, but frankly, it's not as comprehensive as it should be yet. And many people have healthcare providers in different systems with healthcare records that don't communicate electronically. So here are some tricks and tools that can help navigate the healthcare system.
So you want to keep a notebook style planner with a calendar to keep track of when you experience symptoms and what they are. Help keep track of medications that are started and stopped and when those doses are adjusted and which health provider did the adjusting. Keep track of your healthcare visits and write down a short synopsis of what the plan was at each visit. Having all this information in one place can help identify patterns between activities, foods, medications, and the way you feel. You also want to keep a list of your providers with this planner and how best to get a hold of each office. Keep a consolidated list of all your medications with the planner, what the medication is for, what side effects to look out for, and what provider is responsible for refilling that medication.
You could also bring someone you trust with you to your medical visits to help capture the information. And ask each of your healthcare providers, what is the best way to communicate with their office? With a phone call or an online patient portal, through a medical assistant, a triage nurse, or a case manager, and ask to meet that person if they're on site. Sometimes healthcare systems or insurance companies have a patient navigator or nurse case manager system to help manage complex medical care, such as with multiple chronic conditions. This might be a permanent relationship if you meet certain criteria, or a temporary relationship until your health and your care needs stabilize. And it does not hurt to ask if this is available to you.
So, and please keep the guidelines for health monitoring for transplant survivors for reference. Share this with your healthcare provider. I would love to see an online platform to track all of this information for you, but I haven't found it yet. I would like to see something easy to use, but is also viewable by your healthcare providers, because they need to understand the big picture.
Has anyone here used a tool like the planner we've suggested? Do you have any tips? You can take yourself off mute if you'd like to share a tool you've used, or you can add it to the chat. I'm keeping track of that. Or maybe you've found other tools that you've used to consolidate all of your medical care in one place. If there's anything you'd like to share, this is a great time. One app that I've been recently introduced to by a transplant survivor is something called My Med Schedule Plus. It seems to be free. It helps track medications, and it looks like it can incorporate communication from healthcare providers. So she was able to push her medication list from this app to LTFU via email, and it was beautiful. It had a picture of the pill or capsule, really easy to understand instructions on the dosing, what the medication was for, and what provider was responsible for refilling the medication. And I'm interested enough that I'm giving it a try myself to see exactly how it functions.
So let's talk about what you can do for your own health and what you have control over in your life. So all those reminders from your team nurse still apply to us all each day. So reflect on what you ate, how much you drank, what exercise did you do. Eat healthy, hydrate with non-sugary fluids, and exercise in a way that is sustainable. So finding something you like to do will make it a lot more enjoyable and help continue to exercise. And this could be something as simple as walking around your neighborhood, as long as it's done consistently.
And build a social support network. These are a key to a healthy life. Social resources such as interactions with family, friends, neighbors, and peers provide support, comfort, and a sense of belonging, and can be part of post-traumatic growth. So is there a community group that you'd like to participate in, a faith group, a special interest group or club? The Meetup app has groups focused on every subject imaginable. If you want to practice a language, support other writers, or join a book club, there are so many options. Social media is also an option for social support, especially during the pandemic when we've been practicing physical distancing. But social media has a downside, in that the indirect communication common to social media is not always supportive. It's that real-time back and forth interaction where you are held accountable for what you say that's important for social connection.
So volunteering and helping others also helps our own wellness, and it can be a distraction from our own distress. But it also provides a sense of contribution to community and an accomplishment to help others. It doesn't need to be monumental. It could be picking up garbage on a trail, or helping a neighbor, serving meals, participating in a sock drive for the homeless. Does anyone want to share what they've done for their health? Or have you found a routine after transplant that provides comfort, makes you feel good? You can unmute or place it in the chat, or you can save your questions for the end. That's fine too. And a few transplant survivors have told me that they've helped be the match with donor drives to help people sign up as donors for the marrow registry. And transplant survivors have a unique story to tell, and this story can make all the difference.
We would also like to help identify what resources are available during the recovery journey. Everyone should know what is covered by their insurance benefits. Physical therapy and occupational therapy, manipulative therapies such as massage and acupuncture, and what is covered by your flexible spending account if you have one available to you.
And there are charitable organizations and patient assistant programs with valuable education support and financial resources. Be the Match is one, Leukemia Lymphoma Society, BMT InfoNet, Live Strong, and the American Cancer Society.
We know that medication costs can be burdensome, but some drug companies and patient assistance organizations like Live Strong have coupon systems for specific items. A Good RX might have a coupon that decreases your out-of-pocket cost. And the online Cost Plus Drug Company is a newer resource that bypasses insurance. They don't bill your insurance for genetic medications, but they actually might have a lower out-of-pocket cost. And please consider long-term follow-up to be one of your resources. The mission of long-term follow-up is to provide lifelong medical consultation to transplant recipients that were treated at the Fred Hutch Cancer Research Center and Seattle Cancer Care Alliance, which are now combined into the Fred Hutch Cancer Center, and to also provide support for the healthcare providers caring for you. Long-term follow-up has evolved over the years. In the early 1980s, the Hutch had long-term follow-up nurses reaching out to patients and their providers after patients went home to collect data on their recovery. And 1 to 3 patients a week returned to the clinic for in-person LTFU visits at that time. In the 1990s, there was a great expansion of long-term follow-up telephone consultation and in-person long-term follow-up visits, since more patients were being transplanted than ever and needed support when they returned home. Today, we're seeing even more patients in person, fielding more phone calls, emails, and faxes more than ever before. And the COVID-19 pandemic caused a slight detour, but I think we're about back in the right direction. If you're not familiar with the service, long-term follow-up is available for survivors and their healthcare providers for transplant-related questions. Calls go through a brief intake process with a patient care coordinator, and if they cannot answer the question, it's triaged by a telemedicine nurse who digs deeper into the clinical issue. And this may require obtaining medical records if they're not already available, or asking for photos to be emailed of the problem areas on the body. And some of the common questions that long-term follow-up receives includes, I was diagnosed with a new medical condition. Is this because of my transplant? Does the treatment for this medical issue change because of my transplant? We know that transplant survivors have a higher risk to develop some of the same medical conditions the general non-transplant population faces. We can't say for certain that transplant caused this, since it might have developed without a transplant, but it's likely transplant and the prior treatments contributed to these medical conditions after transplant. As the general non-transplant population for things like metabolic syndrome, hypothyroidism, and osteoporosis. If another cancer occurs, the treatment might depend on the treatment you received before, because types of radiation might be limited if you've had radiation in the past, and some types of chemotherapies have a lifetime cap on how much you should receive. Other questions we receive is it safe for me to do blank, to have blank treatment? And there is a wide variety of words that can fill in the blanks for those questions, such as activities, medically necessary procedures, and cosmetic treatments. And there are a wide variety of factors to consider. If a treatment's invasive, we want to consider the risk for infection. So how are your counts doing? Are you still immune suppressed? If you had an allogeneic transplant, is there a risk this activity or treatment could cause inflammation, which could precipitate a GVHD flare? Another question we frequently receive is it normal to still have fatigue years out? And unfortunately, the answer is yes. Most transplant survivors lose muscle strength during transplant, and this is difficult to rebuild and maintain. Then there are medication side effects that contribute to fatigue and poor sleep, such as with prednisone. And then late effects such as hypothyroidism and cardiac issues can contribute to fatigue. There's no quick fix, but the best advice we have is consistent, moderate exercise, good nutrition and hydration, and sleep, and to treat those other medical conditions. Another question that's been even more frequent during the COVID pandemic is, when am I no longer considered immune suppressed? When you're wondering if you have a higher risk for COVID infection or if you qualify for other extra vaccine doses, this is something to keep in mind. Generally, those that are at least 2 years out from transplant and off immune suppression are considered to have a normal immune system. More concrete information to consider is, are your blood counts normal? Are your immunoglobulins normal? And are you no longer needing infusions of IVIG? But even if your immune system is normal, if you've had some organ damage or late effects from transplant, these can increase your risk for serious infections like COVID. And the CDC has a long list of these conditions. It includes things like asthma or other chronic lung conditions and diabetes. One other interesting question we receive is, will genetic testing for Ancestry work if I had an allogeneic transplant or stem cells from a donor? Will it give the survivor's ancestry or the donor's ancestry? And the answer is, the results will likely be mixed. Any cell generated by the bone marrow, such as white blood cells, red blood cells, and platelets, these come from the donor DNA. Everything else, like your skin, your hair, your fingernails, those are the transplant survivor DNA. And these ancestry tests usually use saliva or cheek swabs. So the saliva contains the donor white blood cells, and the cheek cells are meant to collect the skin cells from inside the cheek, which is the survivor DNA. But skin cells from the cheeks slough off into the saliva, and when you swab the inside of your cheek, you're also going to collect saliva. So they're going to be mixed. But to me, this sounds like a very interesting episode on a crime scene investigation show, if it's not already.
So we talked about ways that you can help your own health, and we mentioned volunteering. We'd like to take this opportunity to talk to you about the Fred Hutch's peer-to-peer connection program and what it is. So the peer-to-peer connection program is when someone is newly diagnosed with cancer or dealing with a reoccurrence or caring for someone who is, it can be comforting to talk to a person who has been there. So through the peer-to-peer connection, you can use your personal experience to help others who are about to go through transplant and caregivers at the Hutch. If you choose to become a peer-to-peer connection mentor, you will be matched with a patient or a caregiver for a one-time phone conversation. Our goal is to help everyone who participates in the peer-to-peer connection, but we also know that every person is unique and will connect on different levels. Our hope is that you will offer your mentee the gift of active listening and compassion. Sorry. It can be very comforting to talk to a person who has been there. And also, if you're interested in joining, please note that the peer-to-peer connection program is not meant to replace the support patients receive from social work or spiritual health navigator teams or the medical advice that they receive from their care team. So how do you become a mentor? You must meet several criteria to become a mentor. This includes your provider recommending you. You complete an online application and training. You are eligible based on your current health status, and you need to demonstrate respect of diverse lifestyles, cultures, religions, and values. You have to have be able to provide empathy and compassion, ability to distinguish one's own needs from the patients and family members, ability to be flexible and respond to changing needs of the patients and family members, ability to maintain emotional boundaries, active listening, ability to work as part of a team and other volunteers and staff, and also as part of this role, you will need to be able to hear, speak, and review written materials. So if you're interested in being a peer mentor to a patient or caregiver, please send an email to long-term follow-up. Does anyone have any questions about the program? And I think Be the Match and BMT InfoNet both have similar programs. Has anybody participated in a program like this elsewhere? And would you like to share your experience here?
Kristen here. Yes, I am a mentor with the BMT InfoNet organization and also Immerman Angels. And they've both have been great at hooking me up with matches, and I've met some really great people that way.
Well, that's awesome. So you've mentored some people going into the treatment, or were you mentored going into the treatment yourself?
I wasn't mentored myself. I started doing it after treatment. So it's people that are seeking, I'm a acute lymphoblastic leukemia survivor. So it's people that have recently been diagnosed, or I had CAR T cell and my BMT at Fred Hutch. So it might be people pursuing CAR T and wanting to know what that was about, or it could be someone that's going to start the transplant journey and wanting information on that.
That's awesome.
Yeah,
Kristen.
that's
Thank you so much.
fantastic. Thank you so much. And if you're up to it, we'd love to have you reach out and join our team. We would take any feedback as well from your experience.
Be great.
So what we hope you take away here as you continue the transplant journey, the survivorship journey, is appreciate how far you've come. Share gratitude with those that have helped you on the way, and also give yourself so much credit for the steps that you've taken, no matter how small. Build up and maintain your social support networks. Identify your resources and use them. Keep up with the basic health maintenance, even if you feel fine right now. So you've got those providers set up when you do have something wrong. Reach out to help others in whatever way you can, from holding a door for someone to sharing advice as a mentor to volunteering at an event. Another way to help others could be to send a note of encouragement or thanks to your healthcare providers. It's been a pretty stressful 2 years, and I know this would really lift some spirits. I think the inpatient and outpatient transplant staff here would love to see this. So to leave you with a few more resources, our long-term follow-up website contains many pages of resources and is accessible to the public. It contains patient education materials and guidelines for healthcare providers on the many late effects of transplant. And then here's a few other additional resources that LTFU staff frequently refer to.